This work is really looking into the genomic landscape of postmenopausal women who develop lung cancer and have no history of smoking. And our studies particularly focused on the older women because they are the group or the cohort that are most often diagnosed with lung cancer without a history of smoking. So we find a few interesting things through our study. We find that these women tend to have EGFR mutations, particularly mutations of insertion deletion kinds, as opposed to the quintessential single nucleotide polymorphism change, which is the L858R mutation. We also identify that these women tend to have KRAS mutations independent of a signature of smoking. So usually when you have KRAS mutation, the assumption is that the patient has had a history of smoking, but in fact that's not true. And we also see a very particular kind of mutation, which is not having the G12C mutation towards which there's target therapy. So these kind of important genetic aspects was really revealed in our study. We also find a very interesting thing when it comes to copy number alterations, where we see that there are these three groups of copy number alterations where patients find themselves. However, these are irrespective of their history of smoking. So we feel copy number alterations is more characteristic of developing lung cancer and has little or nothing to do with their history of smoking. We also look at certain signatures that we hope to identify what's the possible reason that these individuals with no history of smoking are developing cancer. And what we find is the ApoBex signature and clock signatures really get highlighted amongst the never and light smokers. So that's really an overview of what I presented in today.